Good day, students. This presentation will help you to know the basics to pulseoximetry and plethysmography. Introduction. This graphical waveform and the readings shows us the pulseoximetry level and the plethysmography waveform. Definition. Pulseoximetry is a non-invasive measurement of the amount of oxygen saturation in the arterial blood by means of a pulse oximeter. Oxygen saturation, SpO2, saturation of peripheral oxygen, is the amount of hemoglobin which binds with the oxygen upon the total amount of hemoglobin which is available to bind. The components which are used in a pulse oximeter are a sensor, a photodetector, a cable, and a monitor. Probes can be varied, which can be used both for adults and infants and children. And the parts of a probe are a photodiode, a LED light, and a copper shielding. Indications for use are patients in cardiac or respiratory arrest, patients with chest pain suspected to be of cardiac origin, patients with multisystem trauma, patients who are apneic or who require assisted ventilation, patients with suspected or confirmed carbon monoxide poisoning or smoke inhalation, neonatal patients in distress, patients with suspected sickle cell crisis, hypotensive patients with systolic BP lesser than 80 mm of Hg, and near drowning patients. Principle which is used in this pulse oximeter is the red light and the infrared light, which falls on the hemoglobin of the capillary blood. The oxygenated hemoglobin absorbs the greater amount of infrared light, and the deoxyhemoglobin absorbs greater amount of red light, and which is being received in a receiver, and which sends a signal to the monitor which displays the saturation level of the oxygen in the capillaries. The advantages of this are it's non-invasive, easy to use, can be used continuously to monitor trends, rapid response, and it's inexpensive. The disadvantages are must have good signal to be accurate, inaccurate under certain circumstances, and pressure source burns from prolonged use. The limitations which can be expected while using the pulse oximeter are light emitting problems. It can be due to light failure or light intermittent. Might be due to probe is broken or poor positioning of probe on patient. Light transmission problems like due to contaminants present like nail varnish or dirty hands. And the environmental and mechanical factors like excessive ambient light, strong sunlight, finger toe too small for probe, movement of the patient, patient shivering, vibration, and electromagnetic waves from appliances and mobiles, and unit is not calibrated. Light observing problems like changes to blood, like not enough blood flowing beneath the probe due to hypovolemia or hypotension, changes to color of blood, like high bilirubin levels due to hepatitis or cirrhosis, changes in shape of red blood cell as seen in sickle cell diseases, changes to hemoglobin, like elevated levels of carboxyhemoglobin due to carbon monoxide inhalation, elevated levels of methemoglobin due to congenital alteration or drug-induced anemia affecting iron with hemoglobin. Structural changes like vasculative changes, vasoconstriction due to hypovolemia, hypotension, hypothermia, peripheral vascular diseases, drugs, and medicine use. Identifying pulse problems like cardiac conduction problems, irregular heart rate due to dysrhythmia such as atrial fibrillation, and venous pulsations like tourniquet blood pressure cuff in use above probe or right ventricular failure. Solutions for these limitations and problems are check unit plugs, check probe placement or changes to another probe, remove obstacles to light like nail polish, choose another site, minimize probe motion, choose another site, and then adjust signal averaging time, consider arterial blood gas values, check carbon monoxide hemoglobin level and methemoglobin levels. The normal value for pulseoximetry reading are the reading which shows 95 to 100 is a normal and 91 and 94 shows mild hypoxemia and 86 to 90 moderate hypoxemia and less than 85 severe hypoxemia. Hypoxemia is defined as decreased partial pressure in blood and oxygen available to the body or an individual tissue or organ. Plethysmography is the graphical representation of this blood flow, which is also sensed by this pulse oximetry probe. Definition is pulse oximeters shows pulsatile changes in observance in a graphical form, and this is called the plethysmographic trace or pleth. Because absorption of light is proportional to the amount of blood between the transmitter and the photodetector, changes in the blood volume are reflected in pulse oximetry trace. Hence, pulse oximeter can also be used as a photoplethysmograph. This is a normal wave which shows a rise and a consecutive fall of the wave. And this pleth wave, if it is being deviant from the normal signal, and a flat wave represents a low perfusion to the body part which is being sensed in the signal. Thank you.